Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hello, and welcome to today's ADHD Experts webinar about oppositional defiant disorder, or ODD. ODD is one of ADHD's most common coexisting conditions, with a comorbidity rate of 20 to 45%. Yet, very little is actually known about the causes and treatments for ODD. What we do know is that people with ODD live a life of conflict with virtually everyone: teachers, law enforcement, employers, parents, and spouses especially. So here to explain the overlap between ADHD and ODD, as well as treatment options and strategies, we are extremely pleased to welcome Dr. William Dodson, one of the world's foremost experts on ADHD. Dr. Dodson is a speaker, consultant, and writer, specifically on adult ADHD medicine. He's written more than 100 articles and hosted 10 webinars for Attitude. He's also on our board of scientific advisors. He is a board-certified adult psychiatrist who was one of the first practitioners to specialize in adults with ADHD 25 years ago. In recognition of his contributions to the field, he was named a Life Fellow of the American Psychiatric Association in 2012. He was also the recipient of the National Maxwell J. Schleifer Award for Distinguished Service to Persons with Disabilities. He has a private consulting practice in Denver, Colorado, and we just could not be more excited to welcome him here today. So before I turn over the microphone to Dr. Dodson, I do have just a couple of housekeeping items to take care of. The sponsor for this week's webinar is Play Attention. So for more than 25 years, Play Attention has been helping children and adults improve their executive function and self-regulation. Its program utilizes NASA-inspired technology and is founded on the latest research in neuroplasticity. Each program includes a lifetime membership and a personal executive function coach to customize your plan along the way. It's evidence-based, supported by research. Home and professional programs are available. Please call 800-788-6786 or visit playattention.com to discuss your needs. And you can use the coupon code ADDMAG0121 to receive $200 off. Lastly, those of you who are tuned in live, you can download the slides for today's webinar by clicking on the Event Resources section of your webinar screen. And if you are interested in the certificate of attendance option, please just look for those instructions in an email that you will receive about an hour after we wrap up the live broadcast. For those of you listening in replay or podcast mode, just visit attitudemag.com, search for podcast 346, and there you will find the page to access the slides, the replay, and the certificate of attendance. If you support the work we do here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for the magazine for your family or to share with a teacher or another loved one who could benefit from greater ADHD understanding. And on the topic of greater ADHD understanding, Dr. Dodson, thank you so much for joining us today and for speaking on this very important topic of oppositional defiant disorder.
Thank you. I'm starting this with a quote from William Butler Yeats, trying to emphasize the fact that although it's the adolescent or adult with the diagnosis, the pain of the diagnosis, the dysfunction of the diagnosis is in everybody that knows them. And the title of the presentation, I think, was well chosen because this is a condition that not only harms the identified patient, but it destroys families and can make a stone of the heart. Most people, most of the doctors you'll talk to haven't really heard that much about oppositional defiant disorder or about its ugly cousin, conduct disorder. There's very little research about it, and even less written about the treatment aspect, because we really just don't know that much. Nobody really wants to work with patients who are hardwired to defeat you. Most young researchers will go and find another topic to research. The FDA, in its infinite wisdom, has decided that oppositional defiant disorder doesn't actually exist. They're a very judgmental lot at the FDA. And they've decided that oppositional defiant disorder is really just bad parents, bad kids, or both. And so consequently, you can't approve a treatment for bad parenting. And so when doing so, there's no money for research if you can't ultimately get a drug to market. This has resulted, all of these things have resulted in ODD being what we call an orphan illness. Nobody wants it. There's no national organization for ODD, the way there's a national organization for everything under the sun. There's no research funding, no FDA-approved treatments in the United States. There is in Europe, but not in the United States. And it's probably going to remain that way for the foreseeable future. So, what is ODD and conduct disorder? Well, it's lodged under the category of disruptive behavior disorders. And you have to understand again how the DSM is organized. It's not really designed for me or for you, practitioners or parents or people who have the disorder. It's designed for researchers and actuaries. And so they have to be criteria that somebody can see and count so that you can then do statistics on it and publish a paper. Because if you can't publish, you perish. And so consequently, if you look at the diagnostic criteria, they are all things which are visible and can be counted. They don't do a good job of really getting at the look and feel of the condition. It also ignores the central feature, and that is that the person with oppositional defiant disorder is hardwired neurologically to thwart and defeat people they see as being in positions of authority. This is the feature that alienates them, that destroys families, and destroys their ability to either create or sustain relationships. And yet it's not one of the diagnostic criteria. So it also, therefore, doesn't really tell us how to help people from sabotaging their own care. Anybody who picks up a case of ODD knows that their patient is going to do everything they can think of to sabotage everything you try and do. But the features of ODD are exactly what the name says. The person is oppositional to you, defiant of anything that you want, and try to just basically wear you down to a standstill. ODD is definitely genetic. It's neurological. In the Netherlands, they've done adoption studies in which children have been adopted at birth. One parent had ODD, and the ODD followed the genetics, not the upbringing. So what people with ODD do is it's a perception. If they perceive that somebody's telling them what to do or somebody's an authority figure, they are neurologically obliged to thwart them. And they're willing to suffer the consequences of being up in the authority figure's face and antagonistic to the people in authority. And they can change from being perfectly delightful, charming people to being a snarling ODD patient in the twinkling of an eye based merely upon their perception that you're telling them what to do right now. The DSM-5 criteria, you have to have this pattern of negativistic, hostile, defiant behavior that lasts for at least 6 months, in which you have at least 4 of the 8 criteria that are there. and they list that things happen often without really defining what often means. You could substitute the word frequently. It doesn't really get that much better in terms of telling you exactly what frequency is required to make the diagnosis. Luckily or unluckily, most people with ODD are doing this all the time, so you get to see what often looks like. But they frequently lose their temper. They're very argumentative with adults and authority figures. They actively defy or refuse to comply with adults' requests or rules. They blame others for their mistakes and their misbehavior. This is not my fault. I was provoked into doing this, and my response was exactly what anybody would have done. It's the other person's fault. They go out of their way to deliberately annoy people. They pick fights with other people if things get too dull. They are often very touchy, easily irritated, easily annoyed by others, whether the other person does anything or not. They're often angry and resentful, often spiteful and vindictive. These are not very likable people. It's not fun to be around them. And a constant diet of this can tear apart practically any loving family. People with ODD do not see that they have a problem. The problem is always external, with other people, and other people being too unreasonably demanding. They think that their response is absolutely justified to such terrible provocation from the person in authority. They do not feel discomfort about the pain they inflict on other people. In fact, they see themselves as the victim. And so consequently, they do not have any remorse or regret about the terrible things they do to other people around them, and especially their family. It's as if they have no conscience at all. And it becomes particularly aggravating when they blame you for the fact that they're being so nasty to you. So, how can you tell the difference? Well, one of the problems is ODD is almost always, 99% of the time, found in conjunction with ADHD. I think there are only 13 reported cases of oppositional defiant disorder in people who did not have a diagnosis of ADHD. But they are actually totally different conditions with totally different treatments. People with ADHD have lots of guilt and shame about the pain they cause others, about the meltdowns that they have, whereas the person with ODD has no remorse, feels totally justified in everything that they do. People with ADD want to please, but they can't. They want to succeed, but they can't. The person with ODD wants to defeat and frustrate everybody they see is in a position of authority or power. People with ADHD long for friends, and they'll go to tremendous lengths to make and keep friends. People with ODD can only be around people who do not challenge their behavior, who do not call them out on their nastiness. People with ADHD resist only when they feel like the situation or the person has set them up to fail, and they just say, I'm not doing something where I'm just going to fail and be humiliated. The person with ODD is to make things fail, either through non-participation or through actively defeating the person with the goal. Kids with ADHD are fun to have around. They're very companionable. They're funny, loving, warm. The person with ODD is annoying, and they alienate everybody. So you can see these very different conditions present in the same person. And it can be very confusing who you're talking to at any given time. This behavior will lead people with ODD to be kicked out of everywhere. People with ODD have multiple ugly divorces that never seem to end. Once the person with ODD gets somebody into the legal system, they never let them go. They are fired repeatedly for getting into conflict with their boss, for telling their boss that they don't know what to do, and that, the patient with ODD is going to put them straight. That's always loved by bosses. And consequently, they get fired and they're starting over with a new job, and they never advance. They're always coming in at entry-level jobs. They may go into the military, but they're out again in a couple of weeks and designated as being unfit for military service. And that's a great understatement. They alienate everybody to the point that no one wants them around. If you go downtown to any major city, you're going to see a whole bunch of adolescents wandering around homeless. The vast majority, almost all of these adolescents, have been thrown out of their own homes due to their ODD. I volunteer down in Denver downtown, and 83% of the people that we service, the young adolescents who are homeless, have ODD. Probably about 90% of them have ADHD. So both of them contribute tremendously to homelessness and not being able to really integrate yourself into any sort of society or group. The defiance can be covert as well. As soon as somebody with ODD sees that you, the authority figure, want something, they have no choice. Neurologically, they are obligated to thwart you, even if it means they don't get their own needs met, or that there's a terrible consequence for their defeating the authority figure. Sometimes it can be invisible as sort of a pseudo-compliance. Gee, I'd really love to do that for you, but I can't because of the following reasons. I forgot. I had something else I had to do that came up. I'd forgotten about it. I just didn't get it done. I lost the paperwork. I'm moving. I'd love to comply, but practically anything will get in their way. Excuse me. That went too far. No. There's always this notion in parents, especially, that they're ultimately going to get the upper hand, and they're going to resolve this. They're going to get back in control of their own families. And I'm sorry, that rarely if ever happens. It sometimes happens in that rare person for whom the ODD resolves and goes away, but otherwise it just doesn't happen, because the person with ODD can completely defeat the most powerful authority figure merely by refusing to participate. And this has a long and very honorable history in civil disobedience and passive resistance. Mahatma Gandhi, Martin Luther King, they boycotted lunch counters and bus systems and things like that. They basically just refused to participate until the authority figure came to the table and would negotiate with them. But the person with ODD never lets up. Nothing is ever good enough, because they don't want resolution. They want the conflict to continue. The ODD person can argue forever, because they're arguing with you about what is really happening, what is real and what is not. And they can discount your version of reality just completely offhand. You don't know what you're talking about. You don't know anything about me. They're trying to make me into somebody I'm not and I don't want to be. You weren't there. You don't know. It's basically, you can never even get started, because whatever you say is devalued and told you that it's not what really happened. And they can keep that up forever. Nothing ever gets started. Nothing ever gets resolved. And you're defeated before you ever start. There's back to the pseudo-compliance again. people says, I agreed to give it a try, but really what they're doing is they're setting you up for failure. I'll try the medication, but with the very first dose, they start complaining about side effects. And almost always, this is really quite striking, they complain about things that the medication couldn't have possibly done. They complain about side effects and things like that. They're the exact opposite of what you would have experienced. But they're absolutely firm. I'm not going to take your medication because what you had to offer not only didn't work, it's harmful to me. They have to prove that whatever you have to offer is worthless and, in fact, harmful. They can also change the subject by creating a catastrophe, creating another argument about a subject that you've had 1,000 arguments about. They can lapse into violence, punch a wall out, that sort of thing, or threaten violence. Or just switch to an old unresolved fight that you just can't resist rising to the bait. They change the subject from what you were talking about. And unless you're really quite self-possessed and aware of this tactic, I know I get sucked into it every time. There is a even worse form of ODD. It's called conduct disorder. And about 40% of people with ODD progress into conduct disorder. And conduct disorder is basically ODD with people or animals or property being harmed, seriously harmed, so that you have aggression. These people are the kids on the schoolyard who are the bullies, the kids that threaten and intimidate each other, and they take it on as a full-time job. They initiate physical fights. These are the kids who bring weapons to school. They're physically cruel to people and animals. They steal. And not just on the slide, they confront the victim and make sure that they know who has bullied them out of their possessions. Or these are the date rapers of the world who force young women into sexual activity. They destroy property, and they do so for fun. They lie, they steal, they con other people, they shoplift, they do breaking and entering. These are the people who, if they're out after dark, are up to serious mischief. They stay out all night despite parental prohibitions. They run away from home. They're often truant from school. And all of this begins in middle school. These are the kids who are in trouble with the law early. So are ODD and conduct disorder different? It's just a matter of degree of harm. It's the same disorder. It's just that conduct disorder does physical or emotional harm to everything around them. People, animals, property. There is an early childhood onset, which is defined prior to 10 years of age, and an adolescent onset after 10 years of age. But what you see is there's a big upturn at about 4 to 6, and you see a whole bunch of kids become little hellions just out of the blue. It's like, they're possessed. Then it gets kind of quiet, and then there's another group that announces itself somewhere around the age of 13. There's a strong genetic clustering. You'll see if one kid has ADHD, there will be a series of other first-degree relatives who have ODD or conduct disorder. So therefore, don't wait around to start treatment. It ain't going to go away, or at least the odds are greatly against you. So there is a very typical migration. People usually start off with ODD, and about 20% of people at the end of 3 years will not have the diagnosis anymore. They won't meet diagnostic criteria. Now, these are not delightful children, but they don't meet the diagnostic criteria. There's another 40% that continued to be ODD and making the hearts of their parents like stone. Then there's another 40% that gets worse and goes on to be conduct disordered. And it's the same numbers. About 40% will stay conduct disordered. About 10% will recover and not have the symptoms anymore. And another 40% will become antisocial personalities. And this is our criminal class. These are the people who occupy our prisons. If you go into a prison and do diagnostic evaluations, you're going to find that about 60% will have ADHD, and about 85% will have ODD or usually conduct disorder. Attention deficit hyperactivity disorder does not raise your risk of getting in trouble with the law. It's almost entirely due to the ODD conduct disorder that's coexistent with the ADHD. Oop. I've got a hair trigger on the slides. This goes back to, again, emphasizing that this is not due to other factors. These are not bad, incompetent parents by and large. A kid with ODD or conduct disorder will make anybody look bad in terms of their parenting, but that's not where ODD and conduct disorder comes from. It is not, as far as we can tell, due to trauma. This is not a manifestation of PTSD. This is something that's encoded in the DNA back prior to conception. There's the major study out of the Netherlands that showed that the ODD and conduct disorder followed the genetic, not the upbringing. At the University of Uppsala in Sweden, they looked at the cerebral spinal fluid of adolescents and adults with ODD, and what they found was that the cerebral spinal fluid did not have any metabolic products of serotonin. Serotonin is the neurotransmitter that is calming, quieting, problem solving. So while the FDA does not think that ODD exists, everywhere else in the world, it's clearly a genetic, inherited neurologic condition that even has a biologic marker. But even that kind of evidence does not budge the FDA. Since it's genetic, you will also very likely find another member of the family who's argumentative, oppositional, nobody likes to invite him to parties. If it happens to be a parent, you really have to keep an eye on them because they will sabotage the treatment. Just as they tend to sabotage everything that the other parent wants to do. So, therefore, watch out. Things can always get worse, and usually do. Other people who have ODD in the family will try and sabotage the parent in pain and the therapist. So you have to very quickly identify who this person is and neutralize them, either by confronting their ODD, calling them out, or physical separation. Otherwise, they'll defeat everything you try and do. The other implication of the genetics is that genetic conditions do not respond very well at all to talking therapies. It makes about as much sense as trying to lower a fever with a talking therapy. It doesn't happen. Consequently, with genetic neurologic conditions, in order just to get into the ball game, you're going to need some form of medication. Now, for a lot of people, they do not want to hear this. They don't like the idea of medication, and those people may have to try talking therapies and behavior management and things like that. But once they've done that, I hope that they will still be open to at least giving medications a trial if nothing else has worked. Could it be something else? There are a lot of people who view ODD as being a normal variant of adolescence. These are people who are trying to individually. They're trying to come out from under a very harsh and controlling parent. And I'm sure that happens. And it can look exactly the same as ODD. Sometimes it is impaired language comprehension. The kid just really doesn't understand what's being asked of him. Sometimes it's mental retardation. Sometimes it's early onset bipolar disorder. In fact, there are several studies out of Harvard that shows that early onset bipolar almost always presents as a triad of bipolar, ADHD, and ODD, almost 90% of the time. So it's not one or the other, it's both. And it can be psychotic disorders, usually this severe irritability that's seen in the first episode of bipolar disorder and or schizophrenia. So let's start with behavior management therapy, because there is a very important role to play for behavior management therapy. We're going to talk about the medications, but suffice it to say, what the medications do is it gives you a chance so that the behavior management has a chance of working. Even if the medications do a wonderful job, the person's no longer symptomatic, that person still has to learn how to get along with other people. Up until that point, they've been oppositional defiant. They have been in opposition to everybody else, and they have to go back and do some remedial skill development on how to live in a society. There are two behavioral educational programs, and only two, that have shown some degree of success, i.e. greater than 70% success, and the only ones to show that they last longer than 3 years. So that really narrows it down to what works versus what doesn't. Both of these succeed because they do not give the child or adolescent someone to defeat. To get what they want, they have to go along with the program on the program's terms. It doesn't require anything of the person that is not required of everyone in the society. As such, is non-negotiable. So let's start with the one for children 12 years or younger. This was written by the great Professor Russell Barkley. It's called The Defiant Child. It's got a fire engine red cover. You can't miss it. Be sure to get the 3rd edition because it has a lot of extra stuff in it that you're going to need. So accept no substitutes, get the 3rd edition. The book is actually written for clinicians, not for parents to do it on their own. So you need to find somebody who's a good child specialist, a good behaviorist, to help you as a parent do this program. What usually happens is a whole bunch of parents will get together, do it as a group, and hire their own consultant. I think that actually works better than trying to do it on your own. His book is mostly what's called parent effectiveness training. There are 2 phases to the basic program. One in which you reward appropriate compliance. This is the catch them doing well approach. And you ignore, as much as possible, misbehavior. This is easier said than done. You have to be prepared because it has to be done in the moment. So you need to already have a list of 4 or 5 things that you can praise or reward when things go right. There's also the use of immediate timeouts for noncompliance or breaking well-known rules. Removing somebody from the action, from the society, even with people who are ODD, is quite effective. The key to success is that the parents, both of them, if they're there, have to do these things very consistently over a long period of time, multiples of years. This is not something that you apply this weekend and ODD goes away. That, folks, just doesn't happen. What's new in the Barkley third edition? It sets you up with a token economy like the one we're going to talk about. It encourages the child to play on their own when the parents cannot be interrupted. It has techniques for use in a school setting. It has techniques for older adolescents in high school, and a preparation of techniques for misbehavior in public. When the kid goes thermonuclear in the local store, how do you handle that? Well, you have to be prepared. No one is able to think on their feet. For teens, this is somebody over the age of 12, there's the REST program, the Real Economy System for Teens. It's very much the same way. It's basically an educational program at its heart, and it's educating the oppositional adolescent about what the world is going to require from them, non-negotiably, every time once they go out into the world. This program is free. It is done in the home by the parents, although having a support group is very helpful. This used to be called Tough Love. I'm not exactly sure where Tough Love has gone lately, but it's pretty much the same type of thing. Real quickly, what you do is you figure out how much it costs to have the pleasure of your child's company for a full year, 365 days, and it's every cost, clothing, food, the whole bit, and you then divide that by 7. And that's how much money the kid will get if he does 5 things every day without being reminded. And that's just a nice way of saying without being nagged. And those 5 things are: he has to keep himself clean. He has to keep his area around him clean. Out in the real world, no landlord is going to allow you to trash your apartment. You'll put your stuff on the curb. In return for free meals and a roof over their head, the child must do a major chore every day that benefits the rest of the family. There can be no violence, threatening, disrespect, rolling your eyes, and that sort of thing. Anything that would get you fired at the local McDonald's is off limits. And then health and safety, no drugs, alcohol. They have to honor a curfew. And the person has to do that. If they do all 5 of those things without being reminded, the money is in an envelope by the bedside table. If they miss even one, they get nothing at all. And so in order to get the money that they want to do the things that they want to do, to pay for their phone, to pay for internet hookup so they can be on their video games, to rent the family car so that they can get around, everything that they would have to pay for out on their own, they've got to pay for it with cash in advance in order to get it in this REST program. Let's talk about the medications, because this is what gets you in the game. I will announce my biases, as I already said them, and that is to get in the game, you need some medication just to take the edge off of these snarling kids who are out to defeat you. Even if you don't believe in the medications, you might want to listen anyway. You may need it later. There's no medication that's FDA approved for either ODD or conduct disorder. The American Academy of Child and Adolescent Psychiatry, however, in their practice guidelines say it is important to note that there is very little gold standard double-blind research on medications other than the stimulants for ODD. And the stimulants, by the way, work great. They'll remove about 50% of the symptoms of ODD. Regardless of diagnosis, atypical antipsychotics seem to be most commonly prescribed medication for the treatment of acute and chronic maladaptive aggression. Again, what they're really talking about here is ODD and conduct disorder. Again, the research just has not been done because there's no money to do it. But nonetheless, that's what clinicians use because the medications work. It's a very practical approach. So ADHD and ODD coexist, pushing 100%. These are separate disorders that need separate treatment. So what most people do, everybody I know, start with the stimulants. The research has all been done on methylphenidate because all the research was done in Europe. And amphetamine only became available in Europe 2.5 years ago. But amphetamine works equally well. There's just no research on it. And what we found is that the methylphenidate used to treat the ADHD component will reduce both the severity and frequency of ODD behaviors by half. And just that alone can make life worth living again. Amphetamine works just based on experience, but there's no research to support it. We use the liquid formulations to keep the kid from cheeking a pill and spitting it out later. And there are now 5 different liquid versions of medications, and usually ask them to take the liquid and then wash it down with a glass of water. There's some new research out of Taiwan where they looked at their insurance system. So they were looking at every person in Taiwan. And what they found was that the earlier you started medication for ADHD, the lower the risk of ODD and conduct disorder by 50%. It's a lot. If the methylphenidate was taken consistently. So not only does it help treat ODD, but the treatment of the ADHD is also preventative of the development of these disruptive behavior disorders. And believe me, if you can prevent it, do so. You do not want to go through this. The problem is that if you want them to do it, the patient won't take the medication. It's the very nature of the condition. The patient with ODD doesn't see that they have a problem. You are the problem. Your expectations and demands are the problem. So what's the point in taking medication? And this is what Sigmund Freud referred to as the seduction to treatment. These people do not come in ready to go. Good patients are made and not born. And oftentimes it takes years to accomplish, and it requires infinite patience. What we found is these wilderness programs, military schools, residential treatment plans, and schools have virtually no effect, other than giving the family a much-needed break. Because the person comes right back to the situation they were in before, and picks up where they left off. And the family spent $35,000 to $40,000. So you have to be in it for the long haul in your own home. And it's basically a process of reflecting to the person, how well does that behavior that you're doing right now work for you? Does it really get what you want? Or does it get what you want, but at a terrible price? And you just over and over again reflect to them that their behavior isn't working. It's not that it's right or wrong or what reality is. The question is always, does it work? And the answer is, of course, it doesn't work. It doesn't work for them. It doesn't work for anybody else. And they can see this process of becoming further and further alienated all the time. So at some point, many kids, adolescents with oppositional defiant disorder is willing to at least try the ADHD medications. And they actually get to see that something helps them succeed. So it's not something they're doing for you, it's something they're doing for themselves. The atypical neuroleptics or antipsychotics in the end are probably the most effective. We have 16 different products out on the market, but only 3 of them have been found to have beneficial effect. Risperidone, aripiprazole, which is Abilify, olanzapine, which is Zyprexa. All 3 have oral dissolving formulations. And it's real nice. If a person's going to get a good response, it's going to be quick, a matter of 2 or 3 days, and at low dose, 1 or 2 milligrams. And with the atypical neuroleptics, you get about a 70% remission rate. These people are no longer nasty ODD patients. You get the kid you once knew back. In spite of this, they still need the behavior treatment because they don't know, they haven't picked up the skills about how to get along in the world. And so they're still going to need something like the REST program in order to learn how to be socially successful. And this goes through the dosing schedule. The risperidone is the most frequently effective medication. So most people start with risperidone. They then follow with the next one, which is Abilify or aripiprazole. The one that has the lowest but still substantial robust response rate is the olanzapine or Zyprexa. We usually hold that for last because its most common side effect is weight gain. About a fourth of people who take olanzapine will be gaining 1 to 2 pounds per week, which is a lot of weight, and it's a deal killer. So, what are the take-home messages? ODD and conduct disorder are not the fault of anybody, not the fault of the parents, not the fault of the child or adolescent. They have won the negative genetic lottery. They've got ADHD and they've got a disruptive behavior disorder. There's nobody to blame. And believe me, that is very hard to remember when you've got a snarling kid up in your face telling you what a bad person you are. But it's important that you remember that because otherwise you won't make it till the end. ODD and conduct disorder were once considered untreatable disorders because the patient was hardwired to defeat you, and they didn't see that they had a problem. But we now know that if you have patients and you can just constantly reflect back to the person whether or not their behavior is getting them what they want, many of these children can come around to giving medication a try. Without treatment, these people do not do well in life. Many of them end up incarcerated. Many of them are homeless. Many of them live on the margin. It's a very devastating condition left untreated. Reserve your strength. Try not to get sucked into every pointless argument that the child puts forward. You ask yourself, is this a hill I want to die on? Is this something that's worth engaging with? People with ODD will give treatment a try so long as they can see that it's their idea. And once they have the experience of the medication being tremendously helpful, the door is open. Try not to show enthusiasm for any mode of treatment. It's merely you're being very businesslike. You're not going to argue with them. You're not going to discuss it. This is just what's going to happen. Quick strain for ODD. These are 3 quick questions to ask the parent, actually. Has your child in the past 3 months been spiteful or vindictive or blamed others for his or her own mistakes? Yes is a positive response. How often is your child touchy, easily annoyed, lost his or her temper, argued with adults? 2 or more times per week is a positive result. How often has your child been angry or resentful or deliberately annoying to others? 4 times or more times is a positive response. This has about a 95% accuracy and specificity rate on getting the correct diagnosis of ODD. So that's the presentation. We'll open this up for questions, and we'll see what's on people's minds. Thank you.
Wonderful. Thank you so much, Dr. Dodson. That was such a clear and impactful presentation. I feel that you presented a whole semester worth of material. And I would say that probably the most common question we're hearing is wondering if ODD exists on a spectrum. So specifically, a lot of parents wondering if their child holds it together pretty well at school, but it has all of the symptoms you described at home and specifically with their parents, maybe just I've heard from several, the mother. Could that be ODD, or does that point towards something else perhaps?
Back in olden days when I was in my residency, I was taught that the oppositional defiant child would be that way with everyone, and you would see dysfunction and antagonism everywhere the child went. We now know that that's not true. In fact, it's not even true half the time. It is not at all uncommon for the child to only have ODD behaviors with the parents. And they are great with the parents of their friends. They're great at school, unless they run into a teacher who's somewhat authoritarian. It can be just one parent that they've got the bad attitude with. And that's especially the case if the other parent has ODD and is working against what's called the parent in pain, and is sabotaging them outside of their awareness. So yeah, it can be, and it's not at all uncommon to be, sometimes just the parents and sometimes just the non-ODD parent as well.
Related question, do you know of any support groups for parents of children with ODD? No, that's part of the problem. That's why I was calling ODD an orphan condition, is that there is no national organization like CHAD or NADA or something on that order. Again, 20 years ago, they had Tough Love, but that has sort of dropped out of my field of vision. I'm not sure what they've done with it. What most people do is they find other parents who are being torn apart the way they are, and they form their own groups, and they hire a therapist in common to help them go through this. If you're the only parent or a single parent dealing with an ODD child, there is no condition in life in which you'll feel more alone than having an ODD child who's picking at you all the time. And a lot of parents are very embarrassed that their child is so ill-behaved that they try and just sort of suck everything into the home and try and handle it on their own, and that will destroy them, trying to handle it on your own. Right. Yeah. As we know with ADHD, comorbidity is the rule rather than the exception. And lots of questions here about comorbidity and also how to differentiate. So quite a few people asking how ODD is differentiated from narcissism.
Oh boy, talk about trying to cram a whole month's course into one 2-minute answer. They are very similar. Narcissism is a personality disorder, which is a deeply ingrained maladaptive pattern of behavior, which is lifelong and egosynchronic. In other words, the person doesn't feel personal pain about their behavior. The pain is in someone else. So on those grounds, yeah, the two look exactly the same. The goal is different, though. With narcissism, the person's energy, in fact, it's almost a frantic energy, is to be getting and eliciting positive feedback about how good and great and all that they are. Somebody who does not constantly feed them positiveness, blow sunshine up the skirt, they can turn on them and just be mean, nasty, exploitative, again, because a narcissistic person does not care about anybody else. They are just, other people are just a means to me getting what I want. So they have that I don't care, lack of conscience, lack of sense of responsibility. But again, the narcissist wants positive feedback about how wonderful I am. The kid with ODD conduct disorder doesn't care. They don't care whether you like them or not. They don't care if you don't like what they did. They don't care about feedback. They are neurologically devoted to one thing above all else, regardless of consequences, and that is that they defeat the person in power or authority. They don't want to win. They want you to lose. So
That's very
helpful. How I separate them.
Yeah, very helpful. Very helpful. There was one other, in addition to narcissism, that was causing some confusion, and that was DMDD, disruptive mood dysregulation disorder. I wonder if you could just touch on what that is and also how it's differentiated.
I honestly don't know the clinician that does not despise that new designation. It was put in place in the DSM-5, so that's all the way back in 2013, as a place to put what everybody was calling childhood onset bipolar affective disorder. COBAD was the acronym. And so they gave it an equally terrible acronym for an equally terrible name. But that's basically what it is. The people that they thought were the childhood expression of bipolar. And these were extremely irritable, angry, aggressive children that did not have euphoric mania. They were irritable instead. There's since been a lot of very good quality research, most of it done by Joel Nigg he was out in Oregon, I've forgotten where he is now, but he's done most of it, to show that childhood onset bipolar was tremendously overdiagnosed, which shouldn't surprise anybody. But it wasn't entirely overdiagnosed. And so that's what that DMDD is sort of floating around, looking to settle on childhood bipolar. But that's basically what it is. But it's a muddy, unclear, made things worse rather than better name that they came up with when they redid the DSM-5.
Just another acronym for parents to try to understand too.
Yeah. Don't pay it much mind. It's not going to be there the next for the DSM-6.
Okay, check one thing.
Everybody hates it.
Check one thing off the to-do list. So we are almost out of time, but I do want to squeeze in one prevalent and important question about the treatment, and specifically a lot of concern regarding the use of stimulant medications and whether that could exacerbate the ODD.
No, it does the exact opposite. There actually were 2 slides in there about that's where most clinicians start, is that methylphenidate and amphetamine for the vast majority of children with ODD and conduct disorder will decrease both the frequency and severity of these behavior storms very reliably and largely without side effects. In fact, it's the treatment of choice. And as with so much with these medications, it's what we call a paradoxical effect. Everybody expects the stimulants to make kids worse, that it makes anxiety worse. Well, when we do the studies, all 26 studies show that the stimulants make anxiety disorders better, significantly better. We expect stimulants to make the pre-existing sleep disturbances of ADHD worse. And every study shows that properly used, it makes them better. The fact that these medications are stimulants is just a dumb coincidence. That is not how and why they work for ADHD. So try and put out of your mind all this stimulant stuff and just look at what they do well when they're fine-tuned.
Yep, that was a big concern as well, the overlap with anxiety. We could go on for another 3 hours, but I'm afraid that we are out of time. This was incredibly helpful, Dr. Dodson. Thank you so much. We had, just to give you an idea, of more than 700 questions come in during the presentation. I did my best, but lots of interest on this topic.
Can I ask the audience to be helpful to me? And I'd like to do a quick plug on some research that I and some colleagues have started trying to validate the concept of rejection-sensitive dysphoria in a very scientific way. And so the very first step is to get people to do a questionnaire. And we're looking for two groups. One is people over the age of 18 with clinician-diagnosed ADHD. And not self-diagnosed, but there's a clinician somewhere who's validated your notion that, yes, you do have ADHD. And the second group is people who don't have ADHD who can act as controls. It's just a 20-minute checklist. And if you could give us 20 minutes, we would be forever grateful. So if you are, just send an email to the following address: empathyrsd@gmail.com. empathyrsd@gmail.com. Give your name, your email address, your age, and which group you think you fall into. Somebody with clinician-diagnosed ADHD, or the control group that doesn't have ADHD. We'll do it very, very much like to get as many people as possible.
Wonderful.
Thank you very much.
Yes, RSD is another topic that we could spend days on. We'll go ahead and add that information to the webinar landing page as well, so people can find that and can follow up that way. But for now, on behalf of the Attitude team, thank you so much, Dr. Dodson, for this presentation. And thank you, everyone who has been listening and submitting your questions. We hope this was helpful, and we hope we can do it again and support these parents who just so desperately need it.
Yes.
Thank you. For more Attitude podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com. That's ADDITUDEMAG.com.